in examination condition, the one is not able to think fast enough to analyze the ascitic fluid analysis. So here is a logical mnemonics so that you can recall. See, remember, हम लोग साग क्यों खाते हैं? साग is green leafy vegetables. ग्रीन लीफी वेजिटेबल्स हम लोग क्यों खाते हैं? जब when we have liver ailment. So when our saag is low, so it means that the person is not having liver diseases and he is not so therefore cared about eating saag. So he is eating all around junk food. So for saag less than 1.1 gram, we have to remember that it is due to non-portal causes. And what does non-portal causes would be there? See, biliary leak, nephrotic syndrome, pancreatitis, peritoneal carcinomatosis, and tuberculosis. And if someone is wanting to understand why is there, so that in these conditions we are having less saag. So here is the logical understanding one, that serum minus ascitic is low. When it would be low? When this value is already low. So where it can be? In nephrotic syndrome, protein is being leaked out, so there would be low serum, or this value turns high. That would be in peritoneal carcinomatosis, tuberculosis. So by this mechanism you can remember all this. Now move on to saag. ज़्यादा कब खाते हैं? ज़्यादा when we eat saag more when there is some liver ailment, some disease. So when it is liver ailment, it is basically due to portal causes, portal hypertension occurring. So when there is portal hypertension, he is eating a lot of saag. So we then come to differentiate, analyze that how we can differentiate whether there is ascitic protein less than 2.5 or more than 2.5. See, when the liver is working condition, then the ascitic protein is greater, but when the liver is not in so great condition, so there would be less protein synthesized, and therefore in cirrhosis, late Budd-Chiari syndrome, and massive liver metastasis, in all these three cases, liver would not be functioning normally. So therefore there would be no synthesis of protein, and therefore ascitic protein would be less than 2.5. But when we come on to the next, then ascitic protein is greater than 2.5, and here it is although associated with liver, but liver is still having the capacity to synthesize proteins. So heart failure, Budd-Chiari syndrome, IVC obstruction, and sinusoidal obstruction syndrome.